All right, Chrissy, we got the wires fixed. Dr. Richard Chaffoo, you're ready to go. You're talking to us about our health, and I was about to tell you on my list of things to do, which is somewhere around here, says check your blood type.
Right. You know, people don't realize that, Shally, and the interesting thing about your blood type is, it's very specific. I think why it's important to know your blood type is, God forbid, if you have a serious injury, you come in from an accident, obviously they can do emergency, cross-checking of your blood type, but it's important to know that ahead of time because obviously not every blood type is compatible for transfusions. If somebody has kind of what we call the universal donor, O negative blood, basically somebody with that kind of blood can basically donate blood to anybody. But certainly if you have certain antibodies, you're A or AB or AB plus, then you may not be able to. So it's important to have that information available in your wallet. If you have a very unusual blood type, maybe even as an ID bracelet.
Yeah, you know what I also found out, Dr. Chaffoo, when I called, because I've gotten so much blood work done over the past few years, I thought it would be in my file somewhere. And from what I'm understanding, you have to have like a specific test to be able to, and I didn't know that.
You do. Yeah, exactly. It's a very easy part of your overall blood profile, but you do need to ask for that specifically from your physician. And again, especially if you have an unusual blood type, it's good to have that information identified in your health records and available to you.
Okay, the next one that you say is blood pressure.
Yeah, that's so important, Shally. Hypertension, which basically is defined as a blood pressure greater than about 120 over 80. 120 is that upper number, the systolic number, and the lower number is a diastolic number. So basically, when your blood pressure is anywhere greater than about 120 over 80, by definition, you probably have hypertension. And unfortunately, Shally, we don't typically have symptoms of having hypertension until we have a serious outcome. So the risks of having untreated hypertension long-term are things that we want to avoid, obviously, heart attacks, strokes, chronic injury to our kidneys, and these sorts of disease problems. If you have very high blood pressure, say your blood pressure is, anywhere from like 180 over 120, which is actually a medical emergency, typically in that situation, you would have headaches, you might have shortness of breath, chest pain. Obviously, urgently, you want to get in to see your doctor, but it's good to know your basic urgently be a little elevated. Say if you go to the doctor, someone comes to see me, sometimes they'll have something called white coat syndrome. In other words, they're a little nervous to be at the doctor, a little nervous to have their blood pressure taken, and so the pressure may be a little higher than 120 over 80. Sometimes we'll recheck that, we'll do serial checks of their blood pressure, or they can get them done at a drugstore, but we want to make sure that there's that trend that the blood pressure stays low enough, because we do have evidence that it does cause serious injury without symptoms if not controlled.
Okay, your cholesterol levels, you also want to know those.
Very important. Cholesterol below 200 is the magic number, Shally, but the important thing is there are two types of cholesterol. There's the LDA, or the bad cholesterol, which none of us want to have. We want that to be below 100. And then the HDL, or the high density lipoprotein, we want that to be above 60, or the good cholesterol. And that's important. Not only is cholesterol important, but as we've talked about so many times before, other lifestyle changes besides just watching your diet, exercising, avoiding tobacco use.
You also say to know the state of your mouth.
Yeah, Shally, that's so important, and people don't realize how important it is to get in to see their dentist. There have been studies that have been done that looked at periodontal disease, which is disease of our gums and around our teeth. What happens in that situation is we can have what we call a chronic bacteremia. We're shedding bacteria into our bloodstream, and the problem with that is that stimulates the platelets, the little cells in our bloodstream that are responsible for clotting, and that can clot off vessels in the heart, clot off vessels in the brain, so you can have an increased risk of, in fact, chronic periodontal disease increases your risk for having a fatal MI by twofold, and a serious CVA or a serious stroke by threefold. So for sure, getting to see your dentist, brush your teeth regularly, at least twice a day. Probably most dentists tell us an electric toothbrush is better, flossing your teeth, mouth rinses, just good dental hygiene, and making sure that your dentist is on your checkoff list each year of be seen and make sure that your dental disease, your gum disease is under good control.
And your final piece of advice is your risk of moles, making sure you're checking all that.
Exactly. You know, all of us have little moles everywhere, but the concern that dermatologists have is if there's a change in moles. Now, moles that look unusual or suspicious would be ones, Shally, that have, you know, maybe multiple colors within the mole. The mole is not a circle, but it may be irregularly shaped, larger than the end of a pencil eraser. And these are called atypical nevi or atypical moles. And if you have 10 or more of these on your skin, you increase your risk of getting melanoma, which is a worse skin cancer, by about 12-fold. So certainly getting in to see your dermatologist, having your skin checked. If you have a larger number of moles, you want to get in to be seen more frequently. And what to look for are obvious things. If there's been a sudden change in the size of a mole, if the mole has changed in color, if it's gone from having a regular border to an irregular border, if it's bleeding or ulcerating or any other such symptoms, that's the time to get in to see your dermatologist right away to have the doctor look at that and see if it needs to have a biopsy, because melanoma, like any type of cancer, is highly treatable if it's caught very, very early.
Good to see you. Good advice.
Good to see you, Shally.
Have a good day.
You too.